Thank you for staying with us on Health Matters. I'm Dr. Mark Castellaw with Baptist Medical Group. Next, we have a special guest, Tara Taylor, on our program, here to talk about an incredible story that you're going to be interested in hearing. Tara, we're so glad to have you here today.
Thank you for having me.
Now, you have such a unique story, and you were able to take advantage of some new technology that's at Baptist for children. But tell us this incredible story that you've been on, other television shows already telling your story?
Yeah, last October I posted a picture of my 3-year-old daughter. Probably within an hour of posting the picture, I got a response from one of my friends saying, hey, her eye's glowing. Could be an indication that something's wrong. You might want to check it out. Here's a site. Looked at the site. It was an indication of many things that could be wrong, a lot of scary things. So we went to the pediatrician, and she then referred us to an ophthalmologist that was able to tell us that she had a macular scar. There was some type of mass or cyst that was covering her macular retina area. She wasn't quite sure what was going on with the condition, but she did know that there was an issue and referred us to the Charles Retina Institute, and we saw Dr. Castellaw, who diagnosed her with Coates disease.
Now, it was fascinating that you could look at her in real life and you couldn't see anything.
Absolutely
But
not.
when she had the picture and I guess the reflection of the flash off of her retina is where you could see the glow. Once she was diagnosed with this very rare condition, what happened next?
Dr. Castellaw needed to do some treatments to her eye, so he took us to Baptist Memorial Hospital and was able to get the equipment that was necessary to do the treatments to my daughter.
So there's this new technology that's just become available in this area, is that correct?
From my understanding, yeah. Before you would have to leave the tri-state area to even get treatments for her condition.
Isn't that neat how that worked out?
Yeah, it was a blessing.
It really was. Now, you know, your daughter went through a very unusual and rare condition, but kind of share with us, being a mama, how you feel when something's wrong with your child.
Oh, it's heartbreaking, especially when there's no red flags. You can look at her. There's no indication. She did everything normal. Knowing that we caught it late to a point where she did lose some of her vision, it was heartbreaking. But we did feel very blessed that people were able to, you know, take the knowledge that they have and bring it to us from social media and say, hey, there might be an issue. If our friends wouldn't have stepped up, we would have never known.
Well, God works in a lot of different ways, doesn't he? And we're so fortunate in the Memphis area to have facilities like Baptist Women's and Baptist Pediatrics to help children, St. Jude among others. And we're really, really blessed in this area that we can have health care for children. Well, thank you so much for being here. What an incredible story about your daughter. And she's doing good now?
She's doing great. We go back to see Dr. Castellaw in a couple weeks, and we may be back at Baptist, but that's just part of the treatment. So we've been very pleased with their service and don't mind going to visit them every once in a while.
We'll talk to a pediatric general surgeon in the Baptist system and what she says parents should know. So be sure and stay tuned.